A few short weeks after its birth, deep in the marrow of your bones, after carrying the oxygen that sustains you and soaking up the carbon dioxide that would poison you, the red blood cell quietly dies. The same fate awaits any aging white cell that survives the silent battle against the infections that try to invade your body every single day. And in a heartbeat, they're replaced by one of the 5 million more that swarm in every milliliter of your blood. It is a cycle of death and rebirth that continues uninterrupted and unnoticed every second of your life, until something goes wrong. Not smoking dramatically reduces your chances of getting lung cancer. Eating well, taking regular exercise and maintaining a healthy weight can lower your risk of developing bowel and maybe even breast cancer. Drinking less alcohol improves your odds of avoiding just about all of them. And if you do develop a bowel, breast, prostate, cervical or skin cancer, your chances of a cure are much higher if it's detected early, be it through personal vigilance or routine screening. Blood cancers are different. An innocent 6-year-old girl has just as much chance of developing leukemia or lymphoma as a 47-year-old man carrying half a lifetime of bad habits, or an 89-year-old woman in a nursing home. Leukemia, lymphoma and myeloma can't be detected through routine screening, and no public health awareness campaign is going to lessen anybody's risk of developing them. So instead, we have to put our own blood and sweat into finding cures, or developing drugs and therapies that can turn a terminal illness into a manageable, lifelong condition. There are many Australian charities and foundations that raise money for cancer research. The Snowdome Foundation is different. Our job is to channel government and private investment into the human clinical trials of next-generation blood cancer drugs and therapies. We also support those at Victorian institutes and hospitals who are doing this important work. Every member of the Snowdome Foundation board has a strong connection with blood cancer. We all know what it's like to lie in a hospital bed or sit beside one, hoping for the treatment that will finally turn leukemia, lymphoma or myeloma into conditions that can be managed for a normal lifetime, or better still, cured. And we believe we're on the cusp of making that hope real. When Thomas Edison quipped that genius was 1% inspiration and 99% perspiration, he unknowingly defined the life of a blood cancer researcher. These diseases are mysterious and elusive because, unlike most other malignancies, blood cancers are always on the move, literally. Still, progress has been made. In the 1960s, every mother who was told her child had leukemia walked out of the hospital or doctor's surgery utterly without hope. Today, more than 70% of children diagnosed will go on to live normal lives. The cure rate for adults with lymphoma has increased by 20% in the last decade. And the patient with relapsed multiple myeloma, who had just 6 months to live in the 1980s, can today expect to share up to 5 or more precious years with her family and friends. But as the survivors who've endured the treatments behind these modern miracles will tell you, there are times when the cure feels worse than the disease, which is hardly surprising. For despite the undeniable improvement in survival rates, cancer treatments in 2010 could still be compared to a World War II bombing campaign, waged with highly toxic drugs, invasive treatments, and only very rudimentary targeting. A decade into the 21st century, cancer patients have the right to expect that there has to be a better way, and we're pretty sure we've found it. Cancer is a genetic disease, but not in the sense that it's a condition you inherit from your parents. Rather, cancer is a disease caused by the genes. Genes that suddenly decide to switch off or send confused messages to the cells that they control. The study of these controlling switches is called epigenetics. It's a science at the edge of our understanding of how life works. But a simple way to get your head around the concept is to think of genes as the cookbook of our cells. There's a copy of that book in every cell of your body, and each volume holds more than 10,000 individual recipes. The epigenome is the cook who opens that book, chooses the recipe, and instructs the cell exactly how to prepare it. Now, anyone who's ever set foot in a kitchen will know that the smallest variation from a recipe can have a big effect on the finished dish. And that's essentially how cancer works. If the epigenome is altered or damaged, the genes lose their ability to control the cell. The cell will then grow randomly, and cancer will be the result. But what if we could fix that epigenome? We could attack blood cancers at their source by developing drugs and therapies that reprogram the epigenome and rehabilitate the rogue cell. Drugs and therapies that are less toxic and destructive and more intelligent, targeted, and effective. Well, the exciting news is we are doing this right now, right here in Victoria. Improvements in cancer treatment have never been slow, steady, and regular. Rather, the major advances have come from what researchers call stepwise gains. The 1% inspiration that Edison believed forces a paradigm shift in thinking. As a blood cancer treatment, epigenetic therapies are still in their infancy, but their combination of targeting the instruction manual of the cell and boosting the immune system's capacity to fight the cancer is producing extremely encouraging results, and the momentum is building. Major pharmaceutical companies such as Novartis, Celgene, and Merck are investing heavily, and the US Food and Drug Administration has already approved the drugs vorinostat and romidepsin for the treatment of a rare type of skin lymphoma, and panobinostat is likely to be registered as a treatment for Hodgkin's lymphoma early in 2011. The organizations and groups that the Snowdome Foundation supports have been key to the clinical development of all these drugs. Between them, they have 16 clinical trials in progress, and the team leaders are reporting positive results. When epigenetic therapies work, they do so spectacularly well. But even after all the research and trials that have been done, nobody is exactly sure why, or why some patients don't respond to the treatment at all. If we knew the answers, we could better target epigenetic drugs and therapies and quickly expand their use from the few to the many. The Snowdome Foundation's investment in epigenetics is no research black hole. The cancer research breakthroughs that we hear about in the media are exciting, and it's important that this sort of research continues to be funded. However, at the Snowdome Foundation, we focus our resources on the here and now, funding clinical trials that will unlock the potential of these new epigenetic drugs and therapies. Keeping these clinical trials close to home means we can get these new drugs and therapies to Australians with blood cancer much faster, and that's already translating into longer lives and potential cures. With the support of the state government, the Victorian Cancer Agency has invested $2.3 million to support cutting-edge clinical trials in epigenetics. Trials conducted by world-class experts who are based right here in Victoria. But this is only a quarter of what's needed if this unique consortium is to continue shaking up the way the world looks at blood cancer treatment. So that's where the Snowdome Foundation's work really starts, generating the money needed to make up the difference. Earlier, we said that blood cancer is not hereditary. It is, however, a family disease. When one member develops leukemia, lymphoma, or myeloma, everyone suffers from it. It's a reality we at the Snowdome Foundation have all lived and experienced firsthand. And though the battle has not always been won, we believe that family ties are our strongest weapon. The disease is in the blood. The answers are in the blood. And we believe that soon a host of genetically based treatments and cures will emerge from the bloodline. Australian families fighting together to defeat blood cancer once and for all.